I think just as a I guess housekeeping rule, we're using Slido today for questions. So I'm sure you will have many questions, as I have many, and so it's best you can um, go ahead over to Slido, slide over to Slido, uh, so that we could get your questions. Well, let's just get started. I just want to say thank you, Patty, and the whole VFN team for the opportunity to co-learn today. I am definitely not an expert in this topic today. And so thank you for the invitation to moderate today's session. Also want to thank my colleagues, all of you, some faces I recognize and some I don't, from across the state and the region for joining today's discussion. And as moderator, I get a chance to channel my inner Oprah Winfrey, who is wonderful at these kinds of things. And so I'm channeling Oprah today and would invite you with me to set an intention for today's discussion. And there are some voices I like to bring into the conversation who are not on the panel today to kind of set an intention today. And that is one, the first voice is Ambassador James Joseph. Ambassador Joseph led the National Council of Foundations for over a decade. He served 4 United States presidents, but also had an opportunity to learn leadership from the wonderful, the great, the magnificent Madiba Nelson Mandela. And just want to read something for him to kind of ground us. And he says, philanthropic leaders have access to platforms of power that very few people within community will ever experience. Courageous foundation executives use their moral voice not only have the capacity to influence the issues discussed within their organizations and among their boards, but also to inform and shape conversations in communities. Philanthropic leaders have the freedom to ask questions that government or business leaders in communities might be reluctant to raise. And they have power to influence that most nonprofit, they have power and influence that most nonprofit leaders never enjoy. I view failure of most philanthropic leaders to ask difficult and penetrating questions about communities where they invest their organizational dollars. The second voice I want to bring into the conversation is someone that I've had a chance to work with over the last year. She may not have served 4 presidents, but she has committed her philanthropic life and career to serving families in the South. And in her retirement, she continues to devote her energy to develop the next generation of philanthropic leaders. And her name is Gladys Washington. And she tells us, as she's been working with me and our team over at the Virginia Memorial Health Foundation, learn before you actually do anything. So to be a leader, she helps us to understand that it's important to learn, to understand before you act. And then while you're acting, keep asking questions. And so for today, we'll learn about some of the potential impacts of the impending sunset of the Health and Human Services Public Health Emergency Declaration, and what that might mean for 2 million Virginian lives at the intersection of health and wealth. I think it's important for us to name in many ways that we're talking about life and death for many Virginians. And we have to ask ourselves some difficult and penetrating questions. And so as we hold in tension today's title, Philanthropy's Role, Preserving Coverage as Medicaid Renewal Begins, I want us to think about philanthropy not just as a system, but a network of people, and that's us, real lives, and our role, not just philanthropy roles, but our roles in preserving that coverage as Medicaid renewal begins, because we're going to be talking about a system in which people are a part of in Medicaid. And so our panelists today are great, they're wonderful, they're smart, they know much more about this topic than I, along with you, get a chance to learn from them today. We'll start our conversation today with Debbie Oswalt. She's the Executive Director of the Virginia Healthcare Foundation. And she'll be just really level setting the conversation. She'll give us a good overview of why this topic is important. We also have the opportunity to learn from someone, Sarah Hatton, who's the Deputy Director of Administrations for the Department of Medicaid Assistance for the Commonwealth. And she'll help us to understand what's happening in the state around Medicaid and what the future looks like. And she's pretty cool because she's able to read tea leaves, as most good leaders are able to do, is kind of be able to help us see into the future. And then we have Emily Roller. So if you didn't have an opportunity to check out yesterday's VFN newsletter, she had a wonderful newsletter in which she really laid bare and, you know, for like a person like me, made it very clear about the impacts of this particular sunsetting of an emergency declaration. And then we'll get to hear from someone who is most proximate to people impacted by these systems in Bedford County, Department of Social Services, Andrew Crawford. And so not only will we talk about health, and we're talking about health, but there's also some other implications around food insecurities. And so great. So now we're here, we got a great panel. I get a chance to ask questions. And you have the opportunity to ask questions. And so we really want you to lean into today's conversation. Try to engage yourself in it, try to position yourself as a learner. We're all a part of this network. And so with that, I will now take it over to Debbie, who will help us to level set today's conversation. Debbie.
Thank you very much, Albert. And I also just very much want to thank Katie and Patty and Robin for VFN offering to do this special, it's like a special documentary type thing webinar on this topic of what is called by the federal government the unwinding of the public health emergency in Medicaid. And the first thing I want to do is just get our terminology straight. That's a lot of words that simply mean that coming soon, this is previews of coming attractions, people who are covered by Medicaid will need to renew their eligibility each year once again. This is something that was the case before the pandemic. The pandemic gave a little break to that, and ultimately we're going to have to return to determining eligibility. And so that's really all unwinding means. And I am here to be like Paul Revere, although I could be Paulette or Paula Revere, but I'm here to say the unwinding is coming. The unwinding is coming, and to send an alert out to everyone about to do more than make you aware of it. I mean, this webinar is certainly intended to do that, but we also hope that it will stimulate you to action. And there are so many important things that and roles that philanthropy has and can play. And pretty much every single one of them could come into play here, depending on how you choose to engage in your community. The reason that this renewal of eligibility is such a big deal, and you might be thinking, well, okay, we're going to go back to doing what we used to do. So what? Well, the so what is that, and you will hear about this a little bit more, but people, pretty much all the people that got enrolled under Medicaid expansion have never had to renew. And, you know, most of them have no clue that they are supposed to renew. And so they will get letters and notices, and you'll hear more about this, but they'll be sent to the addresses that are on file for them. So lots of people who are eligible for Medicaid moved during the pandemic. You know, they lost jobs, they couldn't afford their housing, or, you know, they just moved for other reasons. And so that's why this is such a big deal. You know, Sarah will give you the numbers, but, you know, we have about 25, just a little under 25% of the population of Virginia is now covered by Medicaid. And that includes the aged, blind, and disabled. And for those of you who were at the big conference that we just had, that VFN just had, you might recall the dinner conversation about people wanting to focus on the aged as well as children and everybody else. And so this definitely is something that's going to affect the aged, blind, and disabled, in addition to moms, kids, parents, low-income adults, everybody. The estimate is that about somewhere between 270,000 and 400,000 of those currently enrolled will no longer be eligible. So if they're not eligible, they're not eligible, they'll fall off. But the real issue is, for all that remain, we really can't afford to have them fall through the cracks. We can't afford it on behalf of themselves, you know, because there will be a human cost to that. And we can't afford it in our local communities in terms of the health system and the health providers there, who all of a sudden won't be able to generate the revenue that enables them to hire people. This is a challenging time anyway in healthcare, as costs keep going up. And so, you know, Medicaid expansion actually in a lot of rural areas of the state helped create a market for healthcare that really wasn't there much before. So there are a lot of reasons to really focus in on this. Also, to just be aware that, you know, our community health centers and our hybrid clinics, who are all big Medicaid providers, you know, they depend on the revenue generated from their Medicaid patients to help pay their costs. And then for those who are no longer eligible and who may not be eligible also for the subsidies in the marketplace to go and get individual insurance, you know, the free clinics who we all support, you know, are likely to end up having more patients down the road. So there are a lot of reasons to be engaged in this. You know, there is, as Albert said, an article and a link to a related blog, VFN blog post about this and the roles that foundations can play. Emily will also share some highlights of those in her presentation, but we hope you will all, whether healthcare is what you're focused on or typically or something else, this affects all of the people that we all focus on and the communities we serve. It's a one-time thing, so there are lots of good opportunities to get engaged so we don't have any people fall through the cracks.
Thank you, Debbie. That was wonderful. And I want to remind our friends and colleagues, there may be some thoughts that Debbie shared questions. So go ahead and slide those into Slido. And we're going to gather all those questions. And I think we're going to hold most of the questions toward the end. Am I right on that, or am I wrong on that? You know, I should know that as a moderator, but I guess we'll hold.
If there's any very, very, very specific ones for that speaker as we go along, we can address those. But yeah, I think it would make some sense to hold more of them till the end, Albert. So we'll just have to keep watching.
And Albert, I'll let you know. I'm watching the screen as it comes in, so I'll let you know if there are any.
Wonderful.
Any
so I could be my full Oprah self today.
There you go.
All right. So thank you so much, Debbie, for that. And
there is one question real quick. It is, can you provide the link to Emily's blog you mentioned, please? So
So
we'll try to get that linked for you, and we'll put that in the chat room.
And thank you, Debbie, again for your presentation. I think the clarion call for me is that, you know, this unwinding is coming. It's like a canary in the mine. And we need to do something about it, and folks shouldn't fall through the cracks. And so we should all be leaning in, thinking and caring about that. Now I want to bring in to the conversation Sarah Hatton. Sarah, again, is a resident expert about this whole DMAS. She's the lady at DMAS, and so she's gonna help us to understand a little bit. And thank you again, Sarah, for being with us today. And I look forward to hearing your thoughts about this.
Thanks, Albert, and thanks so much to everyone for having me. Can y'all hear me okay, Albert?
You sound great and you look good.
Great. Thank you. And Emily, thank you so much for sharing for me. I lack the technology and skills to do that for myself, so I appreciate it. So I'm going to talk to everyone about the impacts of the public health emergency related to Medicaid from the state perspective. And thanks, Debbie, for that great opening. If we can jump to the first slide, Emily. So when the federal public health emergency was first declared in March of 2020, all states were provided a 6.2% enhanced FMAP, so matching rate from the federal government, with the condition that we did not take any adverse action against any individuals that were enrolled in the Medicaid program as of March 2020. So over 2 years later, we have not taken any action that would close an individual's eligibility or reduce their eligibility for the Medicaid program. And of course, as Debbie mentioned, that has resulted in a big growth in Virginia because we don't have that normal churn of individuals coming in and out of the program. We don't have the closures that we normally see. So since March of 2020, the Medicaid program has grown by over 500,000 individuals in Virginia. And as she mentioned, that means that over 2 million Virginians are currently enrolled in the Medicaid program. That's 1 in 4 Virginians receive Medicaid. 1 out of every 3 babies is born to a Medicaid mother. So we have a large population enrolled in this program right now. And when we get to the end of that federally declared public health emergency, we and our partners at Department of Social Services are going to have to redetermine all of these individuals to see if they are still eligible to receive continued coverage in Medicaid. And there's a couple of things that are tricky here, and Debbie talked about some of those. One of them is that we don't know when the federal government is going to end the public health emergency. So for 2 years, we have done a lot of planning here at DMAS. We have weekly sessions with DSS where we work through how we're going to address the end of the public health emergency. Right now, it's scheduled to end on July 15th. But we know, because the federal government promised all states that we would get a 60-day notice prior to ending it, we know that they're going to extend it. They have not officially extended it yet, but they will. And when they do extend it, they extend it for 90 days at a time. It's up to 90 days, but we're expecting a 90-day extension, no more than 90 days, which will get us through October. And there are already murmurings and rumors that it could potentially go for the rest of the year. So we have had a lot of false starts thinking it was going to end, not knowing what's happening with COVID-19 and when things may change. Sometimes it gets extended because of that. So anyway, we're watching that very closely. We're ready to hit the go button when the time comes, but we really do feel like all of the work that has to be done is going to be an all hands on deck effort. We're really focused on keeping everyone who is still eligible enrolled in Medicaid, and if they're not, and transitioning them to other coverage to make sure they still have that access to health care. So we can jump to the next slide, please, Emily. So as I mentioned, because we do not have an official extension of the COVID-19 public health emergency yet. We are not updating any of our materials to change our timeline. So our timeline is still based on that July end date. However, we do know that that is no longer true. So states are going to have a total, and this is our federal guidance that we've received, we'll have a total of 12 months to redetermine everyone who's in the Medicaid program. So what that means is that over 2 million people are going to have to go through that redetermination process to see if they are still eligible, and if they aren't, to help them with that transition to get the other health care. So we're fortunate in that Secretary Littell, who's our Secretary for Health and Human Resources here in Virginia, he has done a wonderful job in bringing together leadership from all of the agencies that are under his purview, and he's formed a task force. We've even pulled in individuals from the Department of Planning and Budget to assist in this work. And I really do think that these planning sessions have been really helpful in making sure that everyone is aware and prepared for the work ahead of us at the state level. But there's still a lot of work to be done to make sure all of our partners and stakeholders throughout the state are really aware of the work that needs to be done. Next slide, please. Okay, so what we have done at DMS is we have bucketed this work into 3 main areas. And of course, that's what you see here: our outreach and communication, our systems improvements, and our staffing. So we feel that outreach and communication is going to be really important, obviously. So we have rolled out a robust member outreach campaign, as well as education and information for other state agencies, providers, stakeholders. We have lots of great toolkits. We've actually received national recognition for our toolkits, so we could certainly provide those links to everyone to make sure you're aware of where they are. And we do expect that we're going to have some issues, even with our staffing and at local levels. We've had a lot of attrition. There's a lot of people left their jobs during the COVID-19 public health emergency. And the truth is we have a lot more work to do with the same amount of resources that we had prior to the public health emergency. So we need to make sure we're balancing that as well as we are able to, and to also look for other ways to solve for some of that. And some of that is through our systems improvements. We're looking to make sure we can automate as much as we can when we do have to move back to this redetermination process. So we're looking to make some of our like application processes and redetermination processes no touch as possible. So that will help the workload of our local agencies a bit. Next slide, please. Okay, so just to expand a little bit more on our community and outreach engagement strategies, it does have 3 phases. And so our first phase, which we're in right now, and we've pretty much hit pause on, moving forward, we will remain in phase 1 for the remainder of this year, very likely. But this phase is really focused on encouraging members to update their contact information. If we do not know where they are and they are mailed a renewal form to have their eligibility redetermined and they don't respond to it, they will lose their coverage. And if they don't respond to that form and they lose their coverage with Medicaid, we don't refer them to the federal marketplace. We only make those referrals to the federal marketplace when we actually get that renewal form back. So it is critical that we know how to reach people. And Debbie touched on this a little bit too. Having correct addresses and contact information was already an issue across the country. That was a national problem that state Medicaid agencies discuss frequently, how we can better solve for that. But we know that because we have not had contact with these individuals for the purposes of Medicaid for over 2 years, we know that a large number of these individuals have likely moved. People lost their jobs, there were evictions. We have, a harder chance of being able to reach them than we did before. And we are worried about that, and we cannot push enough our campaign of encouraging people to please call and make sure we have up-to-date contact information for them. This phase has been a great opportunity for us because we were able to partner with our managed care plans. Our federal partners gave us more flexibility than we had in the past, which has been very helpful. So our managed care plans have actually been really critical for us in helping with this phase. They are reaching out to our members through all modalities, from text to phone to email to mailings of postcards, and encouraging them to update that contact information. We at DMAS DMAS, we're also doing a lot of work in that area. We have done direct mailings ourselves. We are doing some text messaging to members, and we have a pretty extensive social media campaign, radio ads, television ads. If you haven't seen or heard any of them yet, I hope you do soon. But we are encouraging people to make those changes. That's one thing that I can ask everyone to walk away with today. If you have any way to, spread the word about that piece of education, we would greatly appreciate it. So once that public health emergency finally does end, we will move on to phase 2. And that will be the same outreach of encouraging everyone through all those same modalities, but we'll be encouraging people to complete their paperwork and to return all of the verifications that are needed for that redetermination. And that's going to run through for that full year, that full 12 months. The local agencies of departments of social services will be redetermining that eligibility. And in that piece, that won't be all at once. Right now we're trying to hit everybody all at once and trying to push that message out widely. Our phase 2, it's going to go to people during the month in which their redetermination is due. So not everyone is going to be due at once, nor could we handle the workload of redetermining all of those members at once. So that one will be phased out over that 12-month period. And then finally, phase 3 is also in partnership with our health plans. That is going to be for individuals who do fail to complete their paperwork, but we are able to find them. That's going to be plans reaching out to them within that first 90 days after a loss and helping them to either complete that paperwork, encouraging them to, apply for Medicaid, or helping them to transition to other insurance, be it through the marketplace or any other type of insurance they may need. Next slide, please. And then finally, I talked a little bit about our system strategies. We do have 7 system enhancements. We've already put a few in earlier in the public health emergency. We did put some systems changes in. We have 7 more that will be they'll be completed, a majority of them by the end of this month, and then we have a couple more that'll be going in over the summer. 5 of them we're really happy about. They're permanent solutions that are going to increase accuracy and that no touch by a worker piece that I was talking about. So we're very excited about that piece. I know DSS is as well. 6 of those enhancements that we're putting in have the potential to actually save the Commonwealth some funds. And then 5 of them are going to result in more timely processing, which is really important as well, especially since we're going to have, as I mentioned, so much more work to do, but the same amount of resources and people to actually complete that work. Next slide. And so for our staffing strategies, we've put together at DMAS, we have an agile task force that we've assembled. And this is a group of individuals that's going to be able to jump in and help the local agencies. And I know we're going to hear Andy's perspective from a county level in a little bit, but we have 120 local agencies in the state, and all of them have varying needs. There may be some who need additional staff to augment this work. So we're going to be providing that at DMAS through temporary contracted staff. We were able to secure some American Rescue Plan Act funds in order to bring these individuals on board. So they're going to be here to help with any issues that may come up, supporting those local agencies, cleaning up any of the leftover work. So we're excited to have that group. Our partners at State DSS, they're in the process of exploring the possibility of overtime for local agencies to try to help those workers who, they may have some short staffing and they may need to put in some additional hours. So trying to find that overtime for those individuals. And then finally, we're looking at a statewide redetermination pool, which would really mean local departments of social services being able to jump in and help another county. So one county may be ahead of the game and have their renewals cleaned up, and they might be able to jump over and help another county. Next slide, please. And so this slide talks a little bit about that 6.2% enhanced FMAP that I talked about that we're receiving for not closing individuals who are currently enrolled. And so as you can see by the chart on the right, even with the additional 500,000 individuals that we've enrolled since the beginning of the public health emergency, this 6.2% match still offset 1.2 billion with a B dollars for the Commonwealth over the past 2 years. So it's been pretty impressive. A lot of individuals have been concerned about the additional enrollees that we have right now, but it actually, has brought in a great deal of funds for the state. And I think this is my last slide. And I will just leave this with saying, as Debbie mentioned, we are expecting between 14 and 20% of the individuals enrolled to potentially lose their Medicaid coverage. That does not mean that they wouldn't be eligible for coverage elsewhere. So we do want to make sure that everyone has access to that healthcare as they need it. But that 14 to 20% is right now between 280 and 400,000 individuals. As we continue to sit in this public health emergency, potentially through the end of the year, that number is just going to grow. So we do want to make sure that we are making as many of our stakeholders, as many organizations and groups as we can across the state aware of what is happening, aware of how huge this is for the Commonwealth, so that we can all be there to assist individuals, make sure they have the information and provide that education to them. Thank you all so much for having me.
Well, you are definitely a pro. Thank you so much for bringing all that complexity into something that I can understand. So I appreciate you for that. So there are a couple of questions here for you. Is there any way to identify the population affected by this change on a county level?
Unfortunately, we can't. So 14%, that 14% lower end number, that's the number that we're predicting here in Virginia. This is a tricky number to predict because we don't know everything about all of these individuals right now. We don't know because we haven't been able to touch them. So we don't know their circumstances. We don't know who's in the home. We don't know how much income they may be making right now. So it's tricky to do that until we get to that redetermination piece. So we don't know exactly where they are in the state. The 20% number that I mentioned, that's a national average. So that's how many individuals across the country, 20% are expected to lose Medicaid coverage nationwide. So we know that we're going to fall somewhere between that 14 and 20% range.
And since this next question we'll need to bring in Debbie, we're going to hold this one to the end if that's okay. But I do want to slide a question in here for you. That last question you were saying, even though the state enrolled extra folks, and there was some concern about the cost of that. You're saying that that match helped to offset the numbers? Say that again slowly for me. I'm like a racehorse. I'm a little slow out the gate, but once I get running, I got it. But
that's right. And Albert, I might be a little bit of an expert in some areas. Finance is not my area of expertise, but I will try to slow that one down a little bit. So because we enrolled those 500,000 additional individuals, even if they have not been seeking access to care right now, even if they have not been going to the doctor, we're still paying capitation rates to the Medicaid plan, to the managed care plans on their behalf every month. So that's a cost to the Commonwealth. And we know that we have 500,000 more people that now have the ability to go to the doctor. But even though that has been happening for the past 2 years, that 6.2% enhanced FMAP or match, sorry for my acronyms, has still offset $1.2 billion for the state. So still an additional $1.2 billion. There's some great information out there. I wish I could tell you what all of it is, but I know that's gone to do a lot of great things in the state, like improving broadband and some roads and different things of that nature.
Thank you for that. That's very helpful. You're helping my learning. So thank you so much for that. You did a great job. All right, now we're going to move on to our next panelist, who is the wonderful author of the blog post, who also made it easy for Albert, not that I'm centering myself, but it's very complex things. And so Emily, thank you for your blog post and take it away.
Great, thank you so much, Albert. And I'm going to share my screen really quickly in hopes that, there we go. Well, I think Debbie and Albert have done a great job of hammering out the why this is an important issue, and Sarah has kind of given us a really nice background on the what. I am hopeful to equip you with the how. How can my foundation participate in getting the word out about this largest enrollment event in Medicaid history. And so that is my hope to give you some of that just now. Let's see, can everybody see that okay?
We can see it, and we have faith in you.
Oh, wonderful. Well, that's great. You know,
Me too.
it's contagious when people have faith in you, right? So I know we've already touched on this quite a bit, but of course, why the public health emergencies end actually matters. As we know, there are both economic effects to the end of the public health emergency, as hospitals and health safety net providers throughout the state will see a reduced revenue if their Medicaid eligible patients or members or clients lose their coverage. And on a human level, we know that this is going to have a really profound effect on the most vulnerable of Virginians, those that are our raison d'etre, if you will, the reason that we do what we do as foundations. And we know that lost coverage, I think that the research is very definitive about this, means no care in some cases and delayed care in others. And in particular, I know a big focus area for the aged, blind, and disabled, folks who are enrolled in Medicaid due to being aged, blind, or disabled. Those folks in particular would be unable to access their needed medications and the long-term services and supports on which so many of them rely that they currently access through Medicaid, and many other needed treatments as well in the event that they lose their coverage. And I think too, you know, thinking about kind of the trickle down effect as well for both of these groups, for hospitals and health safety net providers. Hospitals are employers, are a significant, you know, employer for many of the areas that they represent. And for our most vulnerable Virginians, the trickle down effects are there as well for their family members. I think it was Thomas Jefferson who said something like, without health, there is no happiness. And so the lack of coverage and the lack of access to care that could come about as a result of lost coverage would be a significantly detrimental impact for those folks. And so I think I am preaching to the converted to say that foundations play many roles in addition to just grant making, right? And so to help your community prepare for the public health emergencies end and for Medicaid renewals ultimately resuming, one role that you all can play, and this is addressed in the blog post in a couple of sort of more hammered out examples, is you can be a convener. You can bring together many of the organizations that you probably have some pre-existing relationships with, including your local Department of Social Services. We'll hear a great perspective from a local department in just a moment. And your local hospital's chief executive officer to assess just what this impact would look like in your local community. You can also bring together local leaders of health and human services organizations, those organizations who have a vested interest in making certain that their clientele remain covered by Medicaid, for a sort of bi-directional information sharing session. You can listen as well as talk. Of course, we all want to do listening as well as talking in fora like these. And so you can identify exactly what it is that they might need in order to engage. I will show you in just a moment some of the excellent tools that are out there, thanks to our partners at the Department of Medical Assistance Services that are ready to plug and play in case those are helpful too. You also serve as a key information source in your communities. You can educate your local editorial boards for your local papers by meeting with them, and maybe even in collaboration with that local hospital CEO and other key community leaders to let them know what is coming and exactly what it will mean for your community. And then for current and prospective grantees, it goes a long way when your funder asks you to do something, right? And so encouraging them to educate their Medicaid enrolled clientele about what is coming as well can have a significant effect. The other thing that you can do is connect local helpers to key resources, including training and one-to-one help. And so we hope to equip you with some great resources for both of those things. And I also want to share with you just what this has looked like for us here at the Healthcare Foundation. If you have had a conversation with either Debbie or myself in the last 6 months, there is a good chance, I think, that the public health emergency came up at least once. And that is because we're trying to do the very best we can to take an all hands on deck approach, both kind of broadly convening stakeholders and also taking a more targeted approach locally to help prepare Virginians. And so what this has looked like for us is that in every publication that goes out our door and in every forum that we convene, to and including our newsletters, our roundtable meetings, the review process for all of our proposals, and even our grantee letters of agreement, even in our program areas for whom Medicaid enrollment is sort of a secondary focus, we have included this information and you know, an encouragement to share information about the public health emergency and getting the word out about that in all of our communications. We're also funding Project Connect outreach workers. So Project Connect is our longstanding initiative that's in place to provide one-to-one application assistance locally within communities. And so we are continuing to fund outreach workers and have staffed up and added some new outreach workers to our cadre to both alert their existing clients to the need to update their contact information and to prepare for Medicaid renewals resuming, and also to get the word out in their local communities about the need for folks to update their contact information to ensure that Virginia Medicaid can reach them when the time comes. We've also expanded the number of Sign Up Now trainings that we are offering. We've increased the number of workshops to help ensure that those helper organizations throughout the state who have a vested interest in making sure that their clientele get and stay covered can get the training that they need on the Medicaid and FAMUS programs for children and families and those expansion adults. And we've also added a new Sign Up Now training that addresses the extremely complex Medicaid eligibility rules for individuals who are aged, blind, and disabled. In particular, those groups have additional requirements that often kind of involve a more complex renewal process. And we know too that they're often the ones who are least able to complete a renewal on their own. And so you may want to encourage local helper organizations that you support or that you encounter to send their staff to a Sign Up Now training. And some of you may even want to consider sponsoring one in your service area, and we'd be glad to talk with you about that. I wanted to share with you too some of the communication tools that our partners at DMAS have provided. Our Project Connect outreach workers and VHCF as well have used these to get the word out about the need for all Medicaid and FAMUS enrollees to update their contact information to prepare for the public health emergency's conclusion. And even though the public health emergency's conclusion will likely take place later this year, it is important to prepare now. And so this is, phase one per the presentation that Sarah just shared. But we want to help encourage all of our constituencies to keep their contact information up to date. And these wonderful tools from DMAS have helped us get the word out about that. And then many of our Project Connect outreach workers have built in conversations about the public health emergency and the need for folks to get their contact information up to date in the events that they participate in throughout their communities. Many of you probably participate in some community events as well. And one of the pieces within the public health emergency unwinding toolkits that the Department of Medical Assistance Services have put together are some flyers, member-focused flyers. I think they have several different languages represented. And so in rain or shine, as you can see, our Project Connect team members have been getting the word out and also have been leveraging social media to get the word out as well. And these DMAS toolkit materials are available and in many cases are able to be customized. And you can even add your organization's logos to some of them if you use social media. And you're welcome to share our posts as well, the Virginia Healthcare Foundation's posts as well. And as community thought leaders, one other thing that I think foundations can do is to serve as knowledgeable voices about the importance of Medicaid members keeping their contact information up to date. And I know you, like so many of some of our outreach workers are longstanding and well recognized in your communities. And so I wanted to point out this example for you of kind of how this looked for one of our outreach workers, which our friends from the Harvest Foundation probably recognize. That's Ann Walker, the well-known Martinsville, Henry County-based famous lady. She goes by the famous lady in her community, and she has certainly earned it. And she actually, when a local reporter was interested in running a story about the public health emergency and the potential for coverage losses in Medicaid, was the first person that reporter contacted after hearing from one of her contacts that Ann Walker is the lady to call about that. And we know that many of you in your communities are the person to call anytime there is a key issue going on that might impact vulnerable Virginians. And so we encourage you to be that voice in your community as well. And so as we prepare for Medicaid renewals, I would encourage you, maybe as I've been talking, you've already thought of a couple of ideas, but I'm just thinking about ways that your foundation can raise awareness of the coming conclusion of the public health emergency and the resumption of those Medicaid renewals, knowing that the roles that you play in your community as a convener and a thought leader and a key source of information are part of exactly who you are as a funder. And I'd be happy to take any questions as well.
Again, on a wonderful presentation, you've given us some concrete steps that we could consider as we are see this unwinding on its way. So are there any questions? Let's see if we have anything in Slido just yet. Okay, so I don't know. I don't know if this is a question for you or other folks, but like local businesses like the barber shops and other places, are they helping to spread the word? Are you aware of any such thing?
Yeah, I think I could probably pinpoint one if I needed to, but I think, some of the key ways is of course, equipping their staff to be messengers as well. And so many of our outreach workers have those localized relationships where they, will reach out to an organization and, perhaps enroll one of the staff there. And then the staff in turn become a messenger about the value of health insurance and of enrollment into Medicaid. And now, of course, the need to update contact information.
And I think this next question might be more of a DMAS question around if someone's in process with treatment. So we're going to hold this one also toward the end, so we'll have a little bit more to talk about. And so again, thank you for your work, your blog post, but also these concrete steps that you helped us to bring forth. Last but certainly not the least, we're going to bring in Andy Crawford. Andy, in many ways, this discussion has been very high level, very systems, but now we get to bring in more approximate, close to people, everyday ordinary people who actually live in community. And so, first of all, Andy, thank you for your work that you're doing in Bedford County. It's a jewel of a town in between Lynchburg and Roanoke. And so a lot of people don't know that, but it's a cool little artsy town. And so thank you for your work in Bedford. And we look forward to hearing your thoughts and your reflections about what this might mean for the Virginians who live in your county.
Thank you. So as the unwinding comes nearer and nearer, our staff get more anxious and anxious because we know that we just in our locality alone have had a 34% increase in enrollees or in families who are now enrolled in Medicaid. So as we have had contact with these families, we have done our best to make sure they understand that this is a short-term process and that they will have to be redeemed. So some question or renewed. So one question I saw earlier was, do locals know on the county level? So most counties do. In our locality, we actually have kept the cases separate. So we have file cabinets full of cases that were at one time ineligible. And we know when we have to go back and do renewals that we're going to have to look at their current income levels. So when those cases have come to our attention, we've made sure that we've let those citizens know. So when the time comes for folks to start sending us back their information, what we know before COVID is that the people who have Medicaid are just like you and me. When they get their mail, they set it down and they think they'll get back to that sometime. And if they have a wife like mine, they hide it from me. And then I don't know I even got the mail. So we have that worry of will they put the letter down and forget they got it? And will they put it off until, of course, the time has come to the end? So we always have a mad rush of people who get the denial letters and then come back. And we have this process to make sure that we deal with those folks who've just found their letter. What we think is going to happen is we're going to have four different types of people. The people who fill out their paperwork and they're still eligible and they continue on. The people who get the letter and they know they weren't eligible and they say, well, thank you for what we have, for what we've received, and they go to the next insurer. Or the people who will appeal. That would be number 3. So you can appeal your denial. And so we do think that there will be an influx of appeals. Then, of course, the fourth group of people will be those people who reapply. So we anticipate that not only will we have an influx of renewals that we have to work, but we will also have an influx of reapplication, which has to be, you have to work an application within 45 days. So what we do know about those people who are not eligible is that they're likely eligible for something through the marketplace or through their employer. The problem is that marketplace can be expensive unless they are eligible for a subsidy to help pay. And healthcare through your employer can be more expensive than Medicaid. So we will have families who have to readjust their incomes because they may be having to pay for healthcare in a different way that they have not had to pay during the pandemic. We do anticipate that free clinics and federally qualified health centers will have an increase of business. We also have a fear that people may end up back in the emergency rooms for emergency care because they've put off going to the doctor, knowing that the marketplace can be catastrophic insurance where people will put off their maintenance care. So we think that's likely to happen. And then we also are looking at the economy and how not only will families have to figure out how they pay for their medical insurance if they're no longer eligible for Medicaid, but we're also watching the federal government on the extended SNAP benefit. So when the pandemic came through, we also had an increase in the supplemental nutrition program for those who are receiving those benefits. And what the government did at that point was they increased the amount of a maximum allotment by $95. So if you're receiving maximum benefit, you receive $95 increase. Most families were not receiving the maximum benefit. So if you're a single adult with SSI, you may be receiving $20 a month. That went up to $95. But if you're a family, your benefit could have increased as much as to $800 or $900 from 286-ish. So the SNAP benefit is not like nobody receives the same benefit because it's based upon your income, your rent, your mortgage, your light bill. If you have a washer and dryer in your home, if you have pet insurance. So there's lots of different qualifiers to deem how much SNAP you receive based upon your household size. So what we are also watching is how that's going to impact families as well, because since March of 2020, they have been receiving an additional allotment of SNAP, which has allowed some of our food banks and suppliers of food to see a decrease in need. And we anticipate that need will come back as well. So people could have a double whammy. They have to pay for the healthcare premiums and expenses, and they could have a decrease in how much money they receive from supplemental nutrition. So those are the things that we're watching out for at the local level.
Oh my goodness, that was so good. Let me just say thank you, one, for how you have organized not just your department in this work. I mean, being able to just know where the cases are. I mean, smart enough in your leadership to know, hey, this is not going to last always. Let's create a whole new. I wonder how many other folks in the state were thinking like Bedford. Is that a practice across the state, or is that something that you all decided to do in Bedford?
Well, it's different county to county. Many counties have gone paperless. So they have the cases, but they are in a paperless case file on a computer. Bedford was a little slow, and I'm kind of glad we were. We have not transitioned to a fully paperless system yet. So we actually still have case files, which has kind of been good and bad, because it's been bad in that we see the files and we know how they're growing. But what a lot of agencies did not think about, they just assumed that when the public health emergency was over, that we would just simply go in and close those cases. That's what we thought when it first started. But what they didn't think about is that we'd have to reassess their income at the time of renewal. So I think a lot of people thought they could just go close those cases eventually, but they're not. They're going to have to actually send the letter, get the income verifications back, and then make a decision upon whether the people are eligible or not.
Wow. So much complexity here. So how soon after the public health emergency declaration concludes will the SNAP benefit changes take place? Will that happen immediately? How soon, if you know, that would happen?
We are still waiting with anticipation. We don't know.
Got it. All right, well, let's bring the full panel back. There are a couple of questions that we had there in the chat. What I'm struck by, how just hearing you all speak, the potential impacts or the ripple effects that a public policy / practice change can have on a broader ecosystem, not just those who are the end users of the systems, but the actual people who actually work in those systems. And so I'm really struck by just how that one policy decision, and before we get there, are there some advocacy things we need to be thinking about? Is there an advocacy tool play? Because we can ask questions that other people can't ask. And so, is there something we need to be thinking about in the advocacy space that we should be thinking about? Debbie, I think you're
well, are you thinking, Albert, in terms of advocacy to somehow change what's about to happen?
Well, I don't know. I mean, I'm thinking okay, there was a crisis. The crisis not over. And many times we know, and we knew before COVID, all these folks were in crisis, right? Things have to end. There was a decision made that seemed to have some benefits for patients, 2 million Virginians, but also there are some benefits that happen, some economic benefits to the state, right? My grandma used to say, if it ain't broke, don't fix it. What if we just say, okay, I don't know. I'm just saying, I don't know what I'm saying. All I'm saying is, I know if we do something, if the Paul Revere is coming situation, something will happen. And I'm hearing, Andrew, say, they're going to be costs. I mean, there's a lot there. So I'm just trying to understand, is there an advocacy play here that we're not asking ourselves?
Well, I think advocacy can be directed to any number of things. In terms of the actual policy, that comes from the feds. At some point, the public health emergency will be declared to be over, and many of the wonderful things that have been put into place that have really helped people a lot during the pandemic that will trigger their termination with some kind of notice. There's a whole, we could have a very lengthy whole conversation about, wouldn't it be great if a lot of those things could just be extended and be available? But, given the realities of the situation at this point, I think the advocacy that needs to happen is part of what we're doing here today. We're letting all of you as thought leaders know about the coming situation so that you can raise the alarm and the awareness in every Middlesex county and town, like Paul Revere. So so that you can let everybody know about it at a minute. Right now, the advocacy has to be to get people to update their contact information and to keep updating it if they move again before this actually comes to pass. Because, it may be that if their contact information is updated with some of these changes that DMS has made to its systems, the more people that we can automatically renew without having them go through all the paperwork and all that, the better for everybody. And so automatic renewal, doesn't happen for everybody. There have to be certain things in play and in place, but it doesn't happen at all if we don't have their contact information. And so, I think the advocacy for the short term is to really get engaged and involved at the local level.
Yeah, I just, and I'll just say this and move on because I think there's more learning for me here in this issue. Just position myself as a learner again, but it just seems to me that something rather beautiful emerged out of a tragedy. Why should we go back to some? I don't know. I got to work it out. Maybe I need to talk to my therapist about it. Let's get to some questions. Let's get to some questions here. And I'm the moderator, but I'm not going to hog questions. So let me see if the questions will come up. In 1 second.
Pull them up. I can remember one about what's going on to inform the healthcare safety net and to
yes, please answer that question.
The healthcare safety net.
Yes.
And so I can tell you that we've certainly been working with the head of the Free Clinic Association and the head of the Virginia Community Healthcare Association to let them know that this is coming. Luckily, the free clinics got $5 million in the budget that just passed for in ARPA money for FY23 for the coming fiscal year. And so, I have suggested to them that they might want to think about using some of that to contract with people or train people to help all of their patients, and people in their communities know about this and what's coming. Also, we've offered to do a special sign up now workshop for all the free clinic folks if they would like that. Same with the community health centers. Many of them just come to the ones that we do anyway, but that has lots of updated information. The community health centers are very aware of this because it really does have a specific revenue impact on them. And really the hybrid, we have about 10 hybrid clinics now that, they used to be free clinics and now they're free clinics plus Medicaid providers. So this will affect them. They're very tuned into it. I think Andy's correct that we will see likely by the end of the unwinding, we will see more patients at free clinics. We had a significant drop in free clinic patients after Medicaid expansion took hold. And I think we'll see an uptick. The other thing is in the marketplace, the subsidies, one of the things the public health emergency and has also helped happen is significant subsidies in the marketplace that really almost make health insurance free. The silver plan, not totally, but so close to free. It's very, very affordable. And that lasts through December. And then, extending that and making it more permanent, those subsidies was in the Build Back Better bill that did not pass in Congress. And I would be very surprised if it did. And so we're going to be facing kind of a double whammy where, likely be facing kind of a double whammy that as people lose their Medicaid coverage and really aren't eligible to get it again, costs that are very affordable right now for the marketplace are likely to change and cost a little bit more, hopefully not too much more.
I think there's so much we all need to learn about this. There's, it's just, you said a lot there that that I'm still trying to unpack, especially around some of the bills that were in place that could have potentially did something to kind of address this, but I never knew it. So thank you for sharing it.
That was at the federal level, Albert.
Yeah, right. Yeah, I understand. All right, let's ask some of these other questions. Okay, so what will happen if someone's mid-process with an ongoing treatment? Disease and health issues, no, not these timelines. How might this impact someone with a condition that may not qualify?
I think that one of this would be the important part of making sure that there is other coverage available for this individual if they're no longer eligible for Medicaid. We are required by federal law to give appropriate notice to individuals. Unfortunately, that's only 10 days that we're required to give. The way our system works in the state, though, they usually end up receiving around 15 days notice or more, but again, not a lot. So it's going to be really important to make sure we're helping them with that transition as quickly as possible to move into other health coverage. But
the bottom line is, if they're not eligible for the other coverage or we don't get to them soon enough, tough luck.
That's right.
You're mid-process and in treatment, you're stuck.
No, I wouldn't say tough luck. No.
Well, I'm just saying there's no coverage to pay for it if you can't transition to another kind of coverage. And so you could become charity care if you meet the charity care requirements at the local hospital, if it's a hospital related thing. But I mean, really, there are people who could very well get caught.
Oh. Like I said earlier, this is really, it's not just the systems or money or political conversation. It's about literally life and death for a lot of people. And so, this is tough here.
Sure. And Albert, sorry, Andy.
Sarah, I was going to ask you a question.
Sure.
For people who know that their coverage is likely to end, how can they start applying to the federal marketplace early? Because I know there's rules about when you can apply, when you can't apply. Do you have any input on if someone knows they're going to lose coverage, how they can start looking at either employer care or federal marketplace before the unwinding ends?
So outside of the open enrollment period, so from a Medicaid perspective, if they lose their Medicaid coverage, we refer them, right? If we complete a redetermination and they lose it, we refer them. So they would have that opportunity then, but you're asking in advance. Employer coverage, they could do it anytime. A person could actually have employer coverage and still have Medicaid. You can have both things. So that's not problematic. So that could be an option if there's that ability to do that. And we do even have like some premium assistance programs within the Medicaid program that could potentially pay for the individual's premium through their employer. Debbie or Emily, you probably know better than me about the marketplace as far as outside of open enrollment and loss of coverage. Is there anything extra happening right now that would allow them to apply at different times?
There is. So there is a 60-day period after a loss of coverage where someone could qualify for a special enrollment period due to the loss of coverage. And actually, one of the other items that's tied to those enhanced subsidies that Debbie mentioned that are in place due to the American Rescue Plan Act temporarily through the end of 2022, there's a special enrollment period just for those who have a household income at or below 150% of the federal poverty level. And so those who, maybe have been expansion adults up until this point, but, just due to that small income increase have, if the PHE does end sometime before 2022 ends, they would have the option to have a special enrollment period to get that coverage through the marketplace, which can, in some rare occasions, actually be retroactive, but it's often kind of requires a little bit of a complex escalation process to make that happen. But there is a special enrollment option for those folks on the marketplace within 60 days of the coverage loss under normal circumstances.
So they can't, though, Emily, it's not possible to do that in advance of losing coverage, right?
I believe that there is actually a way, but it often requires an escalation rather than being done through the normal process on healthcare.gov.
And that would just be for people who are above Medicaid eligibility.
Correct. So, once we are in the midst of the unwinding and someone has lost coverage and now qualifies for a marketplace policy with maybe some financial help, they would be able to access it then.
Give me a sense of when you say 150% of the federal poverty level. Give me a real number for a ballpark number for somebody that lives in a rural area versus an urban area, what that means.
Well, the federal poverty level is the same no matter where you live. And what is it about now?
It's around, I want to say it's 13,000 is the 100% figure for annual income for an individual. It varies based on household size.
So then
you saying somebody, the household making $13,000.
That's 100% of poverty. So 150% of poverty would be about 21,000-ish for one person. And then depending on the size of your household, that would increase. The amount would increase.
Okay. I'm just saying I make well over that. I got all this bill I'm still going through, and I'm just saying this is crazy. But anyway, I'm sorry. I got probably to talk to my therapist about this. And so, go ahead, Andy. You had a thought?
Did you want to share
that? Andy, you want to say a little bit about how much money local DSS puts into the economy? I'm not sure. I must be realize the economic impact. I don't know.
So yes, I don't think a lot of people understand the economic impact that SNAP, Medicaid, and TANF has for localities. So SNAP and Medicaid are all funded by state and federal dollars. So just for my county of Bedford, with 80,000 people, so if you can get that, your mental model of Bedford, 80,000 people, pre-pandemic SNAP, our citizens were receiving about $6.7 million. Post-pandemic, that number has gone up to 12.7 million.
Oh.
That's just Bedford. Medicaid. FY19 prior to pandemic, 79 million for Bedford. Right now, last year, end of FY21, that's 124 million. So that's the amount of money coming into just Bedford County recipients from state and federal dollars through SNAP and Medicaid. That's money paying grocery stores, anybody who takes EBT, and then of course the 125 million would be your hospitals, your doctors, your federal qualified care centers, CVS, Walgreens, home health, all those folks. So we know that there's going to be an impact locally on the economy and I don't think people are thinking about that. Your grocery stores, I mean, that's a lot of money. That's right. Just one locality.
Right.
And I'm not a big locality. So think about Richmond, Fairfax, Prince William, all the big boys, lots and lots of people. you're talking about it's going to be a hit to the economy, I'm thinking.
Interesting. Woo! Thank you. So given food insecurity throughout the Commonwealth, what is the likelihood that Richmond will keep some level of increase to SNAP benefits? I'm not sure who can answer that.
That's a federal decision. So I think the state has advocated that they could increase the allotments due to the increase in cost, but the allotment of SNAP really is driven by the federal government.
Thank you. There's a question here, also the role of philanthropy is data, being able to be a data provider. Is there a way we can localize the data and understand how deep the impact is on other counties or our specific organizations we serve? So who might be best to help us understand the role of data here?
I can talk a little bit from a Medicaid perspective. We're going to be able to see by locality how many individuals have continued coverage, how many individuals are referred to the marketplace, how many lose coverage or have a reduction in their coverage. So I can speak to that, and I'm sure Andy could provide the same information for other benefit programs that are administered by DSS. Outside of that, I'm not sure what else we'd be looking for. I think I can't see the question now, but I thought there was one that also said about impact to providers or other stakeholders. I'm not sure that we would be able to see that piece, but we could see from a person perspective for the Medicaid and other programs.
Well, and I think that this is why I'm actually so happy that the public health emergency is not ending in July, because it gives us all time to really wrap our heads around the impact of this and to figure out how best to make communities aware of it all. We're just going to, in November, we're going to have midterm elections at the national level, because all of this is national right now. And so the outcome of those elections, right now you've got Democratic majorities in both the House and the Senate. It's a real question as to if that will continue and what the priorities of whoever are the majority starting July or January 1 will be. So, I mean, that's kind of a dynamic to keep in mind at the national level. I do think that, if a foundation wanted to engage locally in raising awareness about the economic impact of certainly related to the loss of SNAP, but also you've got the same kind of thing going on with the loss of the Medicaid coverage. That pays for, a lot of what the hospitals do, as well as different physician offices and really every aspect of healthcare, pharmacies. Back when we were trying to get Medicaid expansion passed, the Hospital Association actually hired a group here, an economic forecasting group, Chimra and Associates, who figured out the value of one person covered by Medicaid for 12 months, in a locality. And so they could really help make the point of just the economic value of having Medicaid coverage. And I'm sure that that data is very old now, but there are things like that that could be done certainly locally. I'm sure if you each talk to your hospital CEO, they could tell you the impact on them. But these are the kinds of things that people need to be aware are coming so they can prepare for them. Even if we can't get everything continued in terms of the subsidies and the extra amounts, people need to be, people who own small businesses or the grocery stores, as well as the larger employers, they need to know what's coming, and people need to be aware of it.
It sounds like you as you stated earlier, we have a lot of work to do. And engaging folks. We're almost at time, and I want to get in at least a couple of more questions. And so humor me a bit. What we're going to do is quick answer on these ones, okay? So whoever can answer it, try to get it done in 30 seconds or less. I think we answered the question around how would the loss of SNAP impact local communities from their perspective. Is there a role for social media like Nextdoor? Yes or no? And how might we get folks on?
I would say yes. I love the idea and would love for anyone who can spread the word on Nextdoor to use it and do so.
How extensive is text messaging, social media campaign to inform clients? I think you call them, use a different.
Every member for whom we have the information for email, text, social media has been ongoing since March, will continue through the end of the year. Radio ads, March through June, television ads. I think maybe they just started in May or June, but they're like 2 or 3 months long. Every single address got, every member got something mailed to them by us and the health plans. And everyone who provided an email address also got an email, and everyone who has a phone also got a phone call.
Good job. Is it appropriate to coordinate with area schools to get the message out to parents? So
yes, and we are doing that. DMAS does that as well, but the more the merrier. Anyone who has a connection there and can help with partnerships, we welcome it, but we have been doing that as well.
I don't have much context here, but where are the outreach workers?
Right here at the link in the chat.
Awesome.
Via our website.
Excellent. Well, first, let me thank you all for your time today. That's both our panelists, but also all of you who attended today's session. So I thank you for your time. Also, I want to thank you for your talent. We are a state with some really great minds, and we have the right folks at the right tables. I think we have to lean into what Ambassador Joseph said earlier. We got to ask ourselves some difficult and hard questions in the times ahead, because our challenge, the problems aren't getting easier, they're getting more complex, and it's going to require some real adaptive leaderships. And most importantly, thank you for the Virginia Funders Network, who pull us together, who can bring us together.